Well, good morning, everybody. This is Daniel Whitehead here in Denver, and welcome to the Doctor's Clinic Call, where the world is your waiting room. And, the truth is they are waiting on you to share with them the innovative, cutting-edge, medicinal therapeutic nutraceuticals that come from Tom Maurer's lab at Sisel International. And a gentleman that knows so much about what's going on and with the labs there and how they do things, knows a tremendous amount because of research study. And, someone doesn't, becoming a doctor is not what you become. It's kind of like who you are. And it just, it really means you care about that wealth and health, the wealth and welfare and well-being of others. And Dr. Kurt Fisnick, that encapsulates you. I mean, that small little definition encapsulates you to a T. And we're jumping into the subjects of autoimmune diseases, and we got some questions to go at today. But let's start off and just let you say welcome. Then I'm going to ask a first real simple question. But first of all, Doc, good morning and welcome to the call.
Hey, good morning, DW, and thanks for having me on. When you were just saying what you said, it's interesting. If you look up the word doctor, it actually means teacher. And so doctors of back in the old days, they used to teach people how to be healthy. And what happened, if you pay attention, look what happened in the last few years, and a lot of people really haven't paid attention to it. Your insurance company now calls us healthcare providers, right? We're not called doctors anymore. We're called healthcare provider. Look at your insurance, your explanation of benefits, that EOB that you get at the end of the month after you've been to the doctor. What does it say? It says, well, your healthcare provider did this. And so they're taking away the doctor part. They're taking away the teacher part because they want to be in control. The insurance company wants to be in control of your health. And so it's interesting, just with what you said, it made me think about that. But yeah, I love helping people get healthy, and I really believe that the key to health is education. The key to keeping people healthy is education. It's not in giving people another drug. It's not in handing them another product and say, here, just take this. Don't question me, just take it. I teach people. I tell them, question every single thing that your doctor does. Question to the point to where they have to actually go research it, because so many times they're just gonna tell you, no, don't take that, and that's their answer, because then now they don't have to go look it up. They just say no. But DW, yeah, back to you. That's kind of what I was just thinking.
Well, we love your thoughts, and we can get inside that brain of yours and extract information. It benefits all of us, so we appreciate you bunches. What would be your definition, and there's so many definitions out there, but what would be your best definition if I said someone has, for an example, an autoimmune condition, and then there's autoimmune disease, and there's autoimmune disorders? Research I've done, I've seen those three terms used, but what would be your definition to describe autoimmune?
Well, I think those three terms are really interchangeable. I mean, whether you call it a disease or a disorder or a condition, it's all kind of the same thing. And really the definition is that, your immune system is designed to attack something that's not supposed to be there. Remember, that our bodies evolved. We evolved over the years. And if we go back, 1,000 years ago, 2,000 years ago, the primary thing that humans had to worry about was infection. And so, in a way, our immune system treats everything like it treats an infection. And what happens is something goes haywire in our system, and the immune system doesn't recognize self from non-self, and it starts to attack the person's own body, the cells of the body. So that's really what an autoimmune disorder is.
Yeah, so it attacks its body, attacks the cells, correct?
Exactly.
Okay. And we're talking about autoimmune diseases. I did a little search, and I was shocked at what, I'll send you the article and stuff, but they were talking about the top 20 autoimmune disorders and conditions, and then also disease. and what they came up with, I mean, they said that one of the number one that's out there, and probably because there's a lot. I don't know that it'd be number one if everyone was being honest and going through those that. But they talk about Crohn's disease, and then also it went into, going back to the 1920s and what they called the carefree 20s is what has been titled for a jillion years. And that's the years that were marked with self-discovery, and the people got their first taste of true independence, and you were encouraged to go follow your dreams. But this age period also particularly was prone to developing autoimmune diseases. And I find that interesting that we have so much information now, but that this started, in the 20s is when it became, very, very, on front page and among doctors, and these autoimmune diseases for some people, because they didn't know how to address them, they were lifelong chronic illnesses. That otherwise healthy young adults in their 20s wouldn't have to go through some of the challenges they had if they had what we have our hands on today. So here's a question that's coming across the wires here. Where we at compared to the 20s and 50s right here in 2017 to combat some of these autoimmune diseases, disorders, and conditions?
Yeah. I mean, I think the thing that we have to think about, why have autoimmune disorders become more prominent, or why do we see more of it percentage-wise? And the answer is that our immune system is going totally haywire, and part of it is because in the last 100 years we've introduced how many hundreds of thousands of chemicals into the world. And the immune system hasn't evolved fast enough to keep up to it. Will it eventually catch up? Oh, you bet. Down the road, we'll all evolve to where, we can handle the Monsantos and the Roundup and the Treflan and stuff like that. But for now, yeah, I mean, it triggers all sorts of autoimmune disorders. The thing about it is that, since that time, in order to feed the ever-increasing population of the world, they've really boosted the cash crops, the corn, the wheat, and so we're all eating those types of foods a lot more than what we did before. If you go back and look, in the early 1900s, the average person consumed 12 pounds of sugar a year. That was it, 12 pounds of sweeteners a year. And now it's about 150 pounds of sugar per year per person. And so we can really blame it on those three things. And then on top of it, you look at longevity in the 1800s, early 1900s. I mean, if you made it to 45, you were considered an old man. And now here, as of the last decade, I mean, we bumped it up to about 80. So we've almost doubled the lifespan of the average human. So those things all take and play a part of it. Are you still there?
Yeah, I was asking a question. I think I had the mute on. When you were talking about, here's a question that came across the wire. You're talking about, a fatty liver tissue. The question is that an autoimmune disease or disorder or something totally entirely different?
That's usually something totally entirely different. Fatty liver, I mean, you can have problems. That's from toxicity, alcohol, but toxicity primarily. It seems like alcohol causes problems with that. Chemo, I've seen people get it from too much chemo. So.
Okay. And then the second thing they had on the list was Graves' disease, and I didn't even hear about it until my sister is challenged with that right now, and in a big way. And her doc said it was brought on because she smokes every day and hasn't yet given that up. It makes no sense to me, and that's okay. You got to love people where they're at, and when they're ready to make changes, they'll make them. Until then, it's our job just to love on them and encourage them the best we can. But that is interesting because that autoimmune disease not only attacks the cells, but it attacks the tissues. It attacks healthy tissue actually, and it includes muscle weakness. It includes muscle deterioration and weight loss due to an overactive metabolism. People's always trying to get their metabolism revved up. Well, that's the one that's way overactive. It gives jitters, anxiety, fatigue, insomnia, tremors, increased erratic heart rate. I mean, it's kind of a very, very debilitating challenge that someone goes through. Well, what's your encouragement for someone that's going through a Graves' disease challenge, autoimmune disorder?
You bet. Well, let's take a look at what Graves' disease actually is. It's an autoimmune disorder where the body's attacking the thyroid gland, and you were mentioning all the things from metabolism, all those different things, and so what in the world would trigger the body to attack the thyroid? Well, let's look at it. What does the thyroid do? It produces a hormone called thyroxine, right? What does the body need to make thyroxine? Well, it needs iodine. And if you go to your periodic table and you remember that from high school, you remember your periodic table, it had the columns and then it had the rows, right? And what it meant was if it was in the same column, you had the same number of free electrons floating around the nucleus of the cell. And so those groupings based on the column, they could interchange with each other. So when we take a look at iodine, again, your body needs iodine for the thyroid, for thyroxine. But in that same column, you've got bromide, you've got chlorine, and you've got fluoride, right? And so if your body isn't getting enough iodine, then all of a sudden it's going to start trying to substitute something else in place of the iodine. Well, I mean, it's going to grab a bromide. Well, people say, well, I don't take bromide. Where do I get bromide? Well, if you drink Mountain Dew, if you drink a lot of different kinds of sodas, there's bromelated vegetable oil in there. They bromulate it. So if you see that word bromelated, you're getting bromide. And there isn't a single receptor site in your body for bromide. So the only thing that bromide will do will trigger something bad. And so if you're drinking Mountain Dew or any type of soda that has it or food that has bromelated vegetable oil, guess what? You're causing problems. You're going to trigger an autoimmune disorder. And then chlorine. Well, we all know where we get chlorine. We drink water. It has chlorine in it. We take a shower, and our water has chlorine in it. When we take a hot shower, it opens up the pores. Your body absorbs the chlorine. We get fluoride, we get it in our toothpaste, we get it in our water. Well, we don't get it in our toothpaste if you're using Sisel toothpaste. But, it's in most water systems and things like that. And what happens is that your thyroid gland starts making thyroxine, and instead of using iodine, it makes thyroxine with iodine, bromide, or chlorine, right? And anybody with any kind of knowledge at all is going to say, well, that's not the same thing. It's not the same thing at all. And so then the immune system, it says, well, what's going on here? And your immune system starts to attack the thyroid gland because it's making the wrong kind of thyroxine. So it's gonna shut it down is what it's gonna do. And we can say, well, we're gonna put that person on an immune modulating drug, which is what the medical doctors do. They put them on an immune modulating drug. They're trying to cut the immune system out. Well, that's not the problem. The problem is that the thyroxine is making the wrong kind of thyroxine, and so you gotta look and see. I mean, is the thyroid still functioning? If it is, then immediately do a detox and remove the chlorine, the fluoride, the bromide, and substitute some good iodine therapy back in there, and then use like we were talking about last week, an adaptogenic herb like chaga, and start getting the immune system to balance itself back out again, and that's how you go about that one. I mean, it's it turns out it's not really.
Yeah, Doc, you phased out there just at the last little bit.
Yeah, I was just saying it's not rocket science. It's just common sense. If you start looking at how do you treat these things? You got to remove the toxicity. You got to remove that trigger, and then using things like chaga, balance that immune system back out again.
So if that person is a coffee drinker, get them on the coffee. Get them on our coffee to start with, huh?
Yeah, the coffee or the Sencha green tea, the Avenger, any one of those would be great for modulating that immune system.
Okay, that's pretty cool. Let's get into another, a chronic autoimmune disorder and disease, and I don't even know how to pronounce this, but it's SOJERNS syndrome, and
Sjogren's syndrome.
Yeah, you've been dealing with that just a little bit, I think, with some of your clients, and we've got people on the call today listening right now that have their pen and paper ready for you to jump in that. Well, Miss Helen's one. She's over here grinning. She's over here like a student in front row class, Doc. I'm just telling you. And that's what it's all about, is stopping these calls, hitting the pause button when you do replay, and jotting down a few notes so you can give people some proper directions. And I'll talk to you later about Graves' disease, and because they're worried about iodine in anything, but so that's another whole. We'll talk about that later if we have time. Let's jump into this one though. How do you pronounce it? Is that Sojourns, or how do you pronounce that?
Sjogren's.
Say it again.
Syndrome. Sjogren's syndrome.
Sjogren's. Okay, got it.
Yep. Yeah, and bottom line is that if you look at it, one of the most common things that we see with it is that the eyes get really dry, and like we were talking about last week, surrounding the eyes, surrounding the inside of the ears, the sinuses, the throat, the esophagus, the stomach, the lungs, the bladder, any part of your body that's exposed to the outside environment is covered with a mucous membrane, and in that mucus you've got healthy bacteria, and so when you have an autoimmune disorder like Sjogren's syndrome, you treat it, in my opinion, you treat it the same way you would Crohn's disease. You start looking at what's causing it. Well, it's a you can't call it leaky gut, but it's a leaky mucous membrane where it's not keeping the bad stuff out. The holes, the lumen have been opened up, and it gets inflamed, and it dries up. And right away they want to put you on cortisone and things like that, and that's just bad because that's going to mess with the adrenal glands. So in my opinion, you treat it the same as you would like Crohn's disease or colitis or anything like that. Remove the trigger, which usually in this case is gluten. Again, according to the Gluten Summit 2 years ago, they said that 100% of people are now sensitive to gluten. We don't have celiac disease; we're sensitive to it, and that's the thing that you have to tell your doctors. I know I don't have celiac, but I'm sensitive to it, and they're saying 100% of us are. And so you remove that, then you get rid of the inflammation with the omegas and rebuild the gut, re-inoculate the healthy bacteria with the Balanced D. You can do the super detox to kind of clean the system out, and then learn how to rotate your foods in your diet. Do some kind of a plan, a meal plan, so that you're not eating the same food over and over and over again. So many people they'll have wheat products day in, day out, every single day. They'll eat bread every single day. And you just don't want to do that. Your body wasn't designed that way.
Well, it's somewhat common, but I don't want to say easily treatable. But what we have with Sisel can make an impact right there with that particular challenge. Correct?
Yeah, I've been working with 4 people with it just this last month. So it was interesting that you brought that up. Yeah.
Well, it comes from Linda Esch, and it's a great question from her. Maybe we'll get into, a few things that can support the system to help take on some of these autoimmune challenges at the end of the call here in a few minutes. But, I just read something on lupus, for an example. lupus was considered, a psychological challenge, 15, 20 years ago. Oh, you just, you're really not in pain. Same thing with chronic fatigue. It's really not real. It's in your head. And a lot of these autoimmune diseases started off with, oh, you just got emotional mental problems and you're just, a hypochondriac and blah, blah, blah. And then as life and research developed, they went, oh my goodness, we were wrong, and there is a problem. But here's what it said about lupus, even chronic fatigue, that it's in 90% of the women, not a 50-50 type challenge, 90% of the women, which leads me to the question, as I research some of this, why do women get more autoimmune diseases and challenges than men? And then, and based on what we're realizing, when menopause hits and a woman goes through that, why are those, they even stop or cut down half the challenge someone's going through with their autoimmune diseases once menopause. It's like menopause is resetting the body for a new season of life, and it's a great season of life, once everything's reset. Now, the resetting process can be somewhat challenging if you're taking it on all by yourself, but my goodness, with Inner Chi for Her and the other things we have to support those challenges, gals are just loving what we're doing. But my real question is, why are women getting more of these than men? And menopause hits, why does the women's either go away or their challenge is so minimal with some of these autoimmune diseases? It's kind of interesting.
Yeah, well, and that's a good question, DW. I mean, a lot of people, they ask me that. They say, why do women tend to have more of these autoimmune challenges than men? Well, it's because we're different. Inside, we're different. A female, they get pregnant. And inside their body, remember earlier I said that if your immune system is doing what it's supposed to do, it's attacking the things that aren't normal on inside the body. And so every cell in your body has the same chromosomes except for when you're pregnant, right? And when you're pregnant, now all of a sudden you've got something in your body that has different DNA than you do. And speaking of women. And so now your immune system has to recognize that. And you don't want it attacking the baby, in the womb, and so the immune system has to sort of recognize that there's going to be times when there's abnormal cells in the body. Well, what happens then is that because of that, the immune system is a little bit challenged in the female. And so when you get to be past menopause, when it goes past that time when a woman can get pregnant, all of a sudden what happens is now you see the incident of autoimmune disorders kind of equaling out between men and women. It's kind of the same. The numbers are, but yeah, that's why it happens, is because otherwise, if the female had the same immune system that men had, babies wouldn't survive in the womb. It would attack and kill.
Wow. Now that's just kind of like, when you say it, it's like, duh, that's common sense. But common sense, just honestly isn't that common.
Yeah, I mean, it's just you got to really start thinking about it, and most people don't. I mean, even most doctors, if you ask them that question, you ask most medical doctors, why does a female tend to have more autoimmune challenges when they're younger? And they don't know how to answer it. I mean, just next time you go to your doctor, ask them that question, and you'll stump them. You'll stump them.
Well, and so, we're jumping into some of that, and, you talk about your top, 8, 9, 10, 20 different autoimmune diseases. You obviously have Crohn's and Graves', and type 1 diabetes was a shocker when you brought that up last week. That was a big-time shocker. And, of course, I got a couple calls afterwards. Doc Fizz says milk will kill you. And I said, that ain't what he said at all. He talked about a protein that attacks the other protein inside your pancreas. Anyways, it was kind of fun. Like, go listen again to that call. And but type 1 diabetes and rheumatoid arthritis and multiple sclerosis and lupus and celiac disease and what's that skin stuff? What do we call it? Psoriasis that people go through. Doc, we can really help support people going through a lot of these challenges. Would you agree with that?
Oh, yeah, and really, like I said last week, I mean, when you think about it, our body, if everything was just perfect, I mean, we'd be like a starfish. Chop off a finger, grow a new one. Chop off a foot, grow a new one, right? That's how our body was designed. That's really how we were designed, but because of lack of nutrition, because of poor air quality, because of water, because of this factor, that factor, even emotion has to play. It has something to do with it. I mean, if you don't think it's going to happen, it isn't going to happen. And so I think that every single disorder, every condition that we have, including cancer, is an autoimmune disorder where your body's attacking itself, but it doesn't know it.
So to stop the attack, you know, I remember Tom talking one time about the immune system, and you know, thank God we have an Avenger because it just comes from a different angle. Body Shield hits it from a different angle, and even there's a lot of value in influence that we have too. Those products right there. But he talked about the Triangle of Life, and particularly he pointed out the Fucoidan, and I want your thoughts on this as well. And he talked about how it can balance the immune system because it's one of the few things that we can lean on to help support the immune system and bring it back in balance. In other words, if it's in hyperspace, like what someone with Graves' disease would go through, and even some of the thyroid, I didn't know that thyroid, just the thyroid itself, out of control, hyper or unhyper, lethargic or going nuts, was an autoimmune disease until we got into all this, and now I realize it is. And I knew some of the other things that you know, it like opened the gateway. It's kind of like a precursor to some autoimmune diseases. That I thought. I didn't know it was one all by itself. But he talked about the Fucoidan being something that can bring a balance to your immune system as well. So if it's going ballistic, it can calm it down a little bit. If it's lethargic and compromised to where you catch everything coming around the corner, it can boost it and support you in those areas.
You bet. Well, and think about it like this, that in every single chronic condition, inflammation plays a part of it. Inflammation plays a part. And Fucoidan gets rid of the inflammation. So what if that was the only thing that it did? What if that was the only thing that Fucoidan did? It'd be an awesome product to have. It reduces inflammation. I've heard it reduces inflammation when it goes to work like 200%. So it's a great product just for that. But you know, they in the ancient world, you know, they used to call it mother's milk because it stimulates the cells of the thymus gland as well, and it helps with that. So it really helps the immune system kind of get back on track again.
Okay, so it brings it in balance, puts it back on track, and so if someone is within a budget of you know, a couple $100, $250, $300, something like that, and they're going through some of these major challenges, I'm going to throw out a few products and you see if you add some or take away some. And right now, so everybody knows, one of the big things that helps people is Avenger. I mean, we talk a lot with Lyme's disease and the whole 9 yards, but my goodness, we're getting feedback on what it does in so many different areas. It's phenomenal. However, you buy one and you're going to pay full price, and the second one you're going to get is going to be, it's on special. It's actually Tom's way of saying, sorry, we run out. And we did. We was out for about 6 weeks, and you know, so that was a bit of a challenge there. So he's just given the second one half price, which is, to me, very generous, and it's a win-win. It's I really appreciate it. So the Avenger would be one. The Triangle of Life would be a set, and that's that would be the next one. And would you then jump into what, Body Shield? Would you jump into? I mean, I was excited to hear about what you said concerning. And this is my big question: is allergies an autoimmune disorder, or is it just a gut disorder? I wanted to ask you that question, but you talked about Omega Plus being a big factor in helping with allergies, and my question is, would that be a recommendation? And I don't even want the word recommendation. Would that be something someone would want to consider to support them in the challenges that they're going through when it comes to, like, those top 8 autoimmune disorders we talked about?
You bet. Well, I'm going to tell you this. I mean, when it comes to autoimmune disorders, here's what I tell people is that, you know, you really treat them all pretty much the same way. Same products, same way. You might add a few things because of symptoms to get rid of some symptoms. But, I mean, what do we got to do? Number one, what triggered it in the first place? Ask yourself the question, what triggered it in the first place? Was it something in the air? Was it something in your water? Was it something in your food? And you're going to figure it out. Process of elimination, you're going to figure it out. And you got to look at families of things. You don't just look at one thing. Like, we don't just say, oh, wheat. It was wheat. No, it could be wheat and barley and oats and rye, because they're all in the same family, right? And you have to look at it that way. I mean, and molds and things like that can cause inflammation. So you got to find the trigger, and you got to remove that. So that's the first part. Think of it, that's the first R. Then what you want to do is you want to reduce the inflammation. Well, what helps reduce inflammation? In my opinion, the best thing that we have for reducing inflammation is, again, the turmeric, the biocurcumin, the curcuminoids, curcuma longa. And where do we have that? Well, we have that in the Renovator, and we have that in the Brain Vitality. We've got the omegas, the super omega, omega-3s. The EPA is a great anti-inflammatory. Vitamin C is another one that you could buy some vitamin C over the counter, and you can reduce that. Fucoidan, like we were just talking about, it gets rid of inflammation. So you want to reduce the inflammation. That's the second R, right? And then what you want to do is you want to take and you want to re-inoculate, right? You want to make the mucous membranes healthy. And so what's the thing in the mucous membranes that make them selective to keep the bad stuff from getting in and allow the good stuff to come in when it's supposed to come in? And that's the healthy bacteria. Where do we get that? We get that from the Balance D. And so you want to use that. The super detox, like we talked about. I mean, that gets rid of the inflammation in the gut. And if you got an autoimmune disorder, I can almost bet we'll find a swollen, inflamed mucous membrane somewhere along the line. And maybe it's not inflamed anymore. Maybe you've had the condition for so long that the inflammation is dried up. And now you're chronically, like Sjogren's syndrome, Sjogren's disease. Now all of a sudden your mucous membranes are just dried up. It'd be like a rubber seal on your engine that's dried up, and now the fuel can leak past it. Now all of a sudden you got a leaky intake manifold, and so having dried up gaskets in an engine is how I would describe it. So think about it like that, and so those are the most important products. And then we look at it, okay, is it affecting your joints, like lupus? Is it affecting the lungs, like asthma and allergies? Is it affecting the gut, like Crohn's disease? Is it affecting the thyroid? So now you can start looking for those specialty products that you need specifically for you based on your condition. But yeah, that's really how you look at every single one of those, and you can make autoimmune disorders really easy to tackle when you start looking at it that way.
Doc, can you hear me? That's amazing. And that gives people some 3 simple steps just to go through. Just, look at your R, see what's going on. And it could be a combination of things. Now, here's something I want to jump into, because it goes back to calls we did in the beginning of the year, and we talked about, the Roundup, and now they've renamed it, and they relabeled it, and they call it different stuff, and they're always doing those little tricks so that, you're using the same junk. So, if it is an environmental thing, which would be the Roundup is an environmental situation, we can't control. People don't realize this. Food travels, anywhere from 1,500 to 1,700 miles before it even reaches the U.S. border, and most of it is thrown on our shelves as organic, and it's not, and so, but it doesn't matter. Just a simple tactic. I mean, as a tactical point of view, washing foods and vegetables and fruits, fish, chicken, whatever you're doing, beef, meats, any kind of meats, in our organic cleanse gives you a way better chance of fighting off some of this other junk. Of course, the best thing to do is grow your own food, if you possibly could. But however, that is a great support system because toxins are one of the things that breaks down that causes immune disorders, diseases, and conditions. And so, am I on the right track there, Doc?
You bet, yeah. I mean, let's just look at Roundup, and you can go back in the program. You can go back to the website and look at the talk that we had on it. So I won't get into a lot of detail, but the original patent on glyphosate, the active ingredient in Roundup, what was it patented for way back in the 1950s, 1960s? Well, they discovered that you could chelate minerals out of things with that. What does that mean when you say chelate? Pull them out. So we got an ingredient here that pulls minerals out of things, right? And so if you have Roundup in your body and it pulls minerals, right, like cobalt, I mean, let's just say cobalt, right, and it pulls the cobalt out of your body, where does your body need cobalt? Well, it needs to make cobalamin, methylcobalamin, which is vitamin B12. We have a huge epidemic of vitamin B12 deficiencies in the country right now. Nobody's really talking about it, but we do. And you know, these researchers, these big smart doctors, you know, they're going, we don't know what's causing it. What's causing the vitamin B12 deficiency in our country? Well, duh, Roundup. And, you know, it's just like when they were studying moose in northern Minnesota. Why is the moose population going down? Well, duh, you brought in the wolf. He's eating them. And that's the same thing here. I mean, the Roundup is pulling the minerals out. It's causing B12 deficiency. It's causing amino acid deficiencies, which triggers brain disorders like anxiety and depression. I mean, and it's causing thyroid disease, one of the most common diseases in our country. Yeah, I could just go on and on and on just about the one chemical, and we've got hundreds of thousands more that we're dealing with.
Well, that makes sense to me. Doc, we can go on with this stuff forever, but the results that we're getting, you know, in the field with people that are going through some of these challenges is crazy good. And we're getting them because they're getting the support that they need to take on the challenges that they're going through. And so get with the person that invited you to this call, and they're gonna help recommend some of the basic products. But Doc got into it. The Triangle of Life is obviously right up there. The Super Omega Plus is a major game changer. Avenger is there as well. The resveratrol that's in the Eternity part of the Triangle of Life is, there's studies coming out on that on just almost like every 2 or 3 months, new things on how that's helping attack challenges that are people that are going through. And so it just comforts me, and I know it does Doc and Miss Helen as well, and our team, to be able to say, you know what, we have got the best of the best of the best. Now, anyone can make the statement their products are the best. We got the best based on results. And results, though often harsh, are always fair. And based on results, people are getting results. We look at the case study testimonies that you hear, people going through some of these challenges. They are seeing some massive results, and their doctors are applauding the results that they're seeing, you know, because it's a matter of, you know, science working for you, not against you. There's a difference between dousing your body with chemicals and what I want to call synthetic narcotics and drugs and medicines, which are there for emergency cases, as opposed to and have a list of side effects, versus giving you something where your side effects are, wow, I'm feeling better. The inflammation's going down. You know, so that's what we got our hands on. That's it for the Doctor's Clinic. Doc, anything you want to say as we close this out today?
That's all I have to say. Have a great day. Thanks for being here.
I know you got more to say, but that's all we're going to get into right now. All right, everybody, we care about you, and if you care, pass a call on. Help someone understand that they've got some support here to get them to help them navigate through their challenges with their autoimmune diseases, disorders, and conditions. And we're excited to hear your results. That's it for the Doctor's Clinic, where the world is your waiting room. See you same time, same place next week. Dr. Kurt, fantastic job. Thank you, sir.
Thanks, everyone. Thanks, DW.